Welcome everyone to our session on projecting childcare and development fund spending for direct services. The majority of CCDF funding is spent on direct services. That's childcare services provided directly to eligible children by eligible childcare providers. Tribal lead agencies may use one or more of three different possible approaches to provide eligible families with direct childcare assistance. Families may obtain a subsidy in the form of a certificate or voucher that they can use to purchase childcare from the eligible provider of their choice. The tribal lead agency may operate a childcare facility, or the tribal lead agency may contract with eligible providers to have childcare slots available to families who participate in the tribal lead agency's childcare assistance program. I'm Jessica Farley, and I'm a technical assistance specialist with the National Center on Tribal Early Childhood Development. And I'm here today with my colleague Shar, and I'll let her introduce herself.
Hello, everyone, and welcome. I'm so glad to be with you today. I'm also a technical assistance specialist for the National Center on Tribal Early Childhood Development, and so excited to talk with you today about project spending for direct services.
There are two main objectives for this on-demand session. First, to assist in your projecting direct services costs, and second, to be able to predict the number of children that your tribal lead agency is able to serve through direct services. Tribal lead agencies can utilize this cost projection tool for direct services to inform their budget development process and to share projected costs with their finance department. To ensure a strong fiscal management system through frequent and effective communication between the CCDF administrator and the tribe's finance department. Strategies of communication could include monthly finance meetings where expense reports are reviewed, budget development meetings to ensure cost categories are identified prior to the beginning of the fiscal year, consultation in the development of the tribal CCDF plan, invite fiscal staff to CCDF trainings and coordination in completing the fiscal reports. There are many decisions that tribal lead agencies need to make in order to ensure equal access to direct services, which is a core purpose of CCDF. This tool is also helpful for tribes working under Public Law 102-477. As we go through the demonstration of the Projecting CCDF Spending for Direct Services tool, we will look at some of the equal access decisions you can make and the cause and effect of each decision within your budget. Some of the decisions we will look at are payment rates, co-payments, and differential rates. To ensure equal access, there are 8 components that must be met. Parents have the option to choose from center-based care, family child care, or care provided in the child's own home. While this is a requirement for tribal lead agencies with large allocations, tribal lead agencies with medium and small allocations could look for ways to provide all types of care. Tribal lead agencies must ensure adequate payment rates are based on an assessment of the cost of care. Base payment rates need to be high enough that they support health and safety requirements, quality initiatives, and staffing for the provider. Tribal lead agencies need to ensure that rates aren't too low that they can't recruit providers. Any additional costs for higher quality care need to be addressed through the tribal lead agency's payment rates. Co-payments need to be affordable. The preamble of the final rules suggests that they be no more than 7% of a family's income at its highest level. It's also important to take into consideration that within the co-payment structure, you don't create a cliff effect once families are no longer eligible for CCDF services. The cliff effect is what happens when a family has a very low co-payment but abruptly moves to paying the full cost of care. A tribal lead agency should ensure that providers are paid within 21 days of receipt of an invoice or before the care is provided, in line with the generally accepted payment practices. Differential payment rates may be considered to support the cost of quality or growing supply for hard-to-find childcare options, like providers offering care during evenings or weekends, or for providers who are incorporating Indigenous language and culture into the curriculum. On top of all of the things that I just mentioned, there may be additional criteria that a tribal lead agency may want to take into account when ensuring equal access. Just be sure to discuss it with your regional program specialist before implementation to ensure that it's allowable. All of these components together ensure equal access to quality childcare for low-income children and their families. Let's move on to discussing the direct service requirements. For tribal lead agencies with medium and large allocation sizes, no less than 70% of CCDF funds should be spent on direct services. Tribal lead agencies with small allocations are not required to provide direct services, but have the flexibility to choose to do so. A tribal lead agency with a small allocation is one that received less than $250,000 in 2016. Tribal lead agencies with medium allocations received between $250,000 and $999,999 in 2016. And tribal lead agencies with large allocations received more than $1 million in 2016. Direct services are defined as child care services provided directly to eligible children by eligible providers. When thinking of how to operate their CCDF program, tribal lead agencies have options for how they can provide direct services. A grantee can choose to operate a certificate program, a tribally operated center, or contracts and grants. Tribal lead agencies with large allocation sizes are required to operate a certificate program, and tribal lead agencies with medium and small allocations have the flexibility to do so. Regardless of the way that tribal lead agencies choose to provide direct services, grantees are responsible for ensuring that all providers of direct services, even tribally operated centers, meet the provider eligibility requirements, follow applicable health and safety standards, and adhere to the tribal lead agency's policies and procedures. Tribal lead agencies with medium and large allocation sizes are required to spend a substantial portion of their CCDF funds on direct services. For tribal lead agencies with small allocation sizes, direct services of childcare is not required, but it is something they could choose. There are two types of payments you'll hear us talk about often related to certificates: the tribal subsidy payment that is paid out to the provider and the parent's contribution to care, often called the copayment. These payments together should equal the total payment to the provider. Now we're going to move on to program budgeting related to implementing direct services, which is sometimes referred to as subsidy administration. To learn more about subsidy administration, we've included a link to the subsidy guide for your reference. On the screen, you'll see an example of a notice of award. Each year, you'll receive a notice of award from the Office of Grants Management related to your tribal lead agency's CCDF funding. This award letter will arrive soon after October 1st. This notice of award includes the annual allocation for discretionary and mandatory funds and is sent to the tribal chairperson or president by the Administration of Children and Families Office of Grants Management. Sometimes CCDF funds are awarded under a continuing resolution by Congress. In that case, grantees will be funded a portion of their mandatory funds until a federal budget is approved. When available, the allotment will be posted to the Office of Child Care's website. It's important that you keep a copy of each award to ensure you meet the direct services spending requirements. If you feel you have not received all of your funding award letters, please reach out to your regional office for assistance. Moving on to the next slide, you will see a pie chart of the budgeting categories and the amount required for tribal lead agencies with medium and large allocation sizes. Remember, tribal lead agencies with small allocations are not required to offer direct services, but must follow the administrative cap and quality spending requirements. In the pie chart, you will see that there's a 15% administrative cap, 8% minimum quality spending, 3% minimum for infant and toddler quality spending, 70% on direct service spending, and the remaining funds are to be spent on non-direct services. Today, we will only be focusing on the direct services piece. For more information on administration and quality expenditures, please see our demonstration of the budgeting template and projection of the quality expenditures and budgeting demonstration on-demand sessions. During this session, we will demonstrate two separate budget activities to project CCDF spending for direct services. To complete this activity for your CCDF program, you will first want to gather some information. You can press pause while you gather the following information if you wish. You'll want your approved FY 2020-2022 Tribal CCDF Plan or your most recent Public Law 102477 Service Delivery Plan. Your most current year's funding level. This can be found in your Notice of Award documents or on the Office of Child Care's website by searching CCDF Tribal Funding Allocations, and your past ACF 700 report, or a report from your data tracker or spreadsheet. We've put an example on the screen for your reference, but you'll want to focus on the areas circled in red, column A3 and A6. If your tribal lead agency is operating under Public Law 102477, you can find this information in your most recent VIA statistical report. Within these documents, you will find the information to insert in the cells of this tool to project your direct services spending. And now I will pass this over to Shar to demonstrate the tool and show you how it works.
We will move to sharing our screen, and soon you will see the first budgeting activity sheet. This activity will help tribal lead agencies with medium and large allocation sizes identify the projected 70% direct requirements for a fiscal year. Remember, the 70% requirement is based on the funds expended, not the funds awarded. For a deeper dive into this topic, please refer to the budget template on-demand session. Now let's quickly walk through this activity. As we go through this activity, you will see my cursor move on the screen, and I will highlight each box as I speak. The first section is where you will enter your funding award amounts from your Notice of Grant Award letters or the information gathered from the Office of Child Care's website. In this example, this grantee received $243,393 in mandatory funds, $30,000 in the discretionary base, and $1,332,313 from the discretionary per child fund, for a total of $1,605,706. In the next section, highlighted in green, is where the discretionary base is subtracted. Remember, the discretionary base is not subject to the spending requirement. In this example, once the discretionary base is subtracted, this large allocation grantee will use $1,575,706 to project administrative costs, quality costs, and the 70% requirement. Moving through this sheet, it will automatically calculate the required or the maximum administrative cost, the minimum quality expenditure, the minimum infant and toddler quality expenditure calculation, and moving down into the last white area of this sheet, it will calculate the 70% direct services requirement. In this example, this grantee must spend $816,216 on direct services. We're going to take that amount and move it to the Projecting CCDF Spending for Direct Services tool. You will see on the screen change again, where we will open up the tool. In looking at this example, please follow my cursor to cell J27. Here you will see the $816,216 from the previous budgeting exercise. I'm going to give it back to Jessica to talk about the Projecting CCDF Spending for the Direct Services tool.
On your screen, you're now seeing the template for Projecting CCDF Spending for Direct Services. And looking at the overall tool, you will see in column A that this grantee listed the age groups of children that they're serving. They listed infants, toddlers, preschool, and school-age children. You'll want to refer to your FY 2020-2022 Tribal CCDF plan to find the age groups you have selected to serve and use the related cells to calculate your projections. In column B, you will see the provider types listed alongside each age group. Again, refer to your CCDF plan to determine which provider types you have chosen, and then utilize only those types when completing this projection tool. In column C, highlighted in green, you will find cells where you can enter the number of children you are projecting to serve in each age group. You can utilize information in your ACF 700 report or the data tracker to find the previous number of children you have served to begin the process. This will give you a baseline of what was previously spent on direct services. Perhaps your tribal lead agency is considering serving more children in the upcoming year, by changing the numbers of the children. This tool will calculate the cost of those additional children in the cell highlighted in dark green here. Watch this cell as I demonstrate. In column D, you will enter your monthly rates for each age group and provider type. If you are currently paying weekly, you can multiply your weekly amount by 4 and enter that amount. If you are paying daily, you can multiply your daily rate by an average of 20 days and enter that amount to assist you with this calculation. As you begin entering this information, you will see the numbers begin to change down at the right of the sheet in the section highlighted in dark green. It's important to keep an eye on this section as it changes in relation to the required amount you entered in the beginning of the demonstration in cell J27 here. Now I would like to call your attention to column J, highlighted in green. This grantee has entered into this cell $150 a month, which is the average copayment of current clients. You can find your average copayment by looking at your ACF 700 report or by running a report in your data tracker. Column H projects how much families will pay in copayments towards the total cost of care. You will notice when I change the amount in this cell, the number in column H, highlighted in blue, changes, which will ultimately change the amount the tribal lead agency will fund for direct services. There are times that tribal lead agencies may want to change their payment rates. This tool would allow you to project those additional costs. By entering your proposed rates into column E, you can calculate the new total expenses as well as identify the monthly and annual difference in cost in column F and G respectively. Any cells that are highlighted in light green in the top portion of this sheet can be changed by the grantee. All of the other cells are locked to ensure correct calculations. Once you've entered all of your information into the light green highlighted cells, the total projected expenses will calculate in cell I-23, which is highlighted in dark green. Now I'm going to turn it back to Shar to talk about quality spending and its relation to direct services.
Thank you, Jessica. Now let's move to the bottom of the worksheet highlighted in orange. This is where tribal lead agencies have the flexibility to pay providers higher rates, either by a percentage or a flat amount, based on their quality goals. These additional amounts can be referred to as rate multipliers or rate add-ons. In this example, this grantee has chosen rate add-ons for non-traditional hours, children with special needs, and providers who are native language speakers. Highlighted in the blue section in cell J28 here, this grantee has determined they will spend $126,056 for rate add-ons using quality funds. They also determined that the rate add-on will be 1.2%, which is a 20% increase of the normal monthly rate as listed in the chart above. This is just an example. Tribal lead agencies have the flexibility to choose any amount that fits the needs of the tribal community. You can see this amount in cell E25 here. Below this cell, you will see the percentages listed in the three cells: 7%, 7%, and 5%. These percentages represent the amount of the total children who are in non-traditional care, have special needs, or are being served by providers who are native language speakers. These percentages will be unique to each tribal lead agency and can be changed with this projection tool. Let's take a look at the amounts in the orange section as I change one of the percentages. As you can see, this projection tool updates the amounts for you. Finally, let's move to the blue highlighted section of this document, cell J26. This cell shows the total projected amount with the quality spending included, and in this example, the amount is $495,547. Below that, highlighted in yellow, is the 70% funding requirement of $816,216 that we entered when we began this process. And then, highlighted in blue, is the $126,056, which is the amount budgeted for the use of quality funds for rate add-ons. To see the amount left to spend, move down to the next cell. According to the calculations, this grantee must spend an additional $412,676 on direct services to meet the requirement, and another $34,049 to meet the rate add-ons of their quality spending plan. Now that this grantee has determined that they need to spend additional dollars to meet the 70% direct services requirement for tribal lead agencies with medium and large allocation sizes, they could use this projection tool and make some changes to increase spending. They could choose to serve more children, increase provider rates, lower co-payments, or choose additional rate add-ons. Remember, you can adjust any of the cells that are highlighted in light green to change your projections. One of the great things about this tool is that it can help you determine the number of children you can serve so that you know when you should start a wait list or an enrollment freeze to ensure that you don't overspend from your direct services fund. Thank you for taking the time to learn about this tool, and I'm going to hand it over to Jessica to share some resources available to you.
Thank you for joining us. This Projecting CCDF Spending for Direct Services tool is available to grantees by requesting technical assistance through your regional office. Your National Center on Tribal Early Childhood Development Technical Assistance Specialist can assist you with projecting spending for direct services. We are always happy to provide feedback as you go through the budgeting process. This concludes our on-demand session 4. This session is one of a 5-part fiscal series. Our other sessions include CCDF Fiscal Management and Introduction, using your CCDF plan and other tools for justification purposes, a demonstration of the budgeting template, and projection of quality expenditures and budgeting demonstration. You can complete the series by visiting our website. Additional resources have been provided to support you with fiscal management. Please download from the landing page. We have a copy of the American Indian and Alaska Native Child Care and Development Fund Guide to Subsidy Administration for medium and large allocation grantees and a rate setting template. If you would like to request technical assistance, please reach out to your Office of Child Care regional office and your program specialist will be happy to assist you. If you are a Public Law 102-477 grantee and would like technical assistance, please reach out to your Office of Child Care regional office and copy your BIA representative. Thank you for joining the session. We are so glad that you took the time to listen to this information. Feel free to reach out with any questions.